Namaste to you. I would like to share my experience in the treatment of obesity. It's such a big, silent, long-term assassin. This disease or clinical entity is so rampant in the society. It doesn't spare the teenagers nor the people in the 20s or 30s and the 40s and 50s. It's a predecessor of many ailments. It is basically an entity that's not just excess body fat. It leads to a cascade of a host of other ailments and challenges of metabolism. And of course, this is a very high reason of morbidity in the Indian society. It's not just about leading to diabetes and heart disease. It also puts somebody psychologically off. So what would be called as obesity? The easy understanding is excess body fat, and somebody can self-diagnose it obviously. And to a good extent, it is self-treatable too. The fact of the matter is, we may consider people as obese based on the body mass index, which all of us know. And between 25 to 29.9, we may keep it as overweight, and above 30 would lead it to the diagnosis of obesity. However, my personal take is that body mass index is not the ultimate indicator, simply because we all know the muscle bulk is 18% heavier than the body fat itself. So what about an athlete or a very muscular built person who has a trim waistline? Will he be called obese simply because his body weight is more or the BMI is more? I think that would be definitely unscientific and not appropriate. So this brings us to the point about the waistline. If a lady has more than 35 inches of waistline, if a man has more than 40 inches of waistline, I think it is a simple red flag. So this brings us to the point, what is the possibility from Ayurveda? The greatness about the science of Ayurveda is that it encourages and enables, empowers an individual to heal himself with the right kind of guidance from the professional and sometimes by self-modifiable methods. Anyone who is obese, obviously we have to keep the idea of hormonal issues in mind. We will keep such kind of not easily curable entities in mind, but nevertheless, usually a combination of judicious food, lifestyle, yoga, medications, therapies, and many such activities which a person can manage himself or herself helps in the weight loss, obviously, and also helps to sustain the weight loss, which is very important, because the hitting the plateau is very common and the rebound weight gain is a big trouble to deal with. This brings us to the point, what is the general benefit people get when they stay in an IPD level situation in terms of the gains they make short term and long term? And our experience at Athreya Ayurvedic Center is that going through the process of Panchakarma and such detox process very intense manner with modifiable food patterns and yoga and such integrated approach, we find that majority of our people who come to us, the health seekers or the patients who come to us, they're able to lose at least 5% to 7% of their body weight they come with in a span of typically 2 weeks time. However, there have been some who have lost even up to 10% of the body weight they come with. Importantly enough, majority of them are able to sustain this weight loss for the next 2.5 to 6 to 9 and even up to 12 months duration after departure from Athreya Ayurvedic Center. And I'm optimistic that this may be the result other Ayurvedic centers also have, most likely. So this brings us to the point, what can be expected in terms of specific data of inch loss and weight loss? What is the guarantee that Ayurvedic physician can offer? Now, I would be happy to share with you what we normally find results in Athreya Ayurvedic Center regarding weight loss. If somebody is asking for a guarantee, the first answer I would very humbly and frankly upfront convey is there's no guarantee of weight loss. The reason is being simple. Having come across people from 104 nations, of nearly 5,000 of them over the last 15 years time, we have realized one simple fact, that there's no guarantee in weight loss. However, we do find a common pattern, which is a majority's pattern. people losing up to 6 to 8 kilograms of body weight in a span of 3 weeks' time. It's very variable, nevertheless, and losing up to 3 inches of waistline about 3 weeks' time. Similarly, we do get sometimes shocked to find that there are some people who lose not even 3 kgs in 3 weeks' time, and not even a couple of inches of the waistline lost in 3 weeks' time. On a better note and a happier note, we have had people who have lost 7 kilograms in just 10 days' time, losing up to 13 kilograms in 40 days' time, and sometimes, exceptionally enough, finding great changes in the metabolism, and along with the weight loss, finding that they are depending upon insulin much lesser, that the blood fasting levels or postprandial fasting levels of sugar are much better, and significantly enough, they feel very much agile and with high stamina and with a lot of clarity to the body and mind, and a sense of great enthusiasm and zeal for life. So that is why we don't only convey the aspects of benefits to inch loss and weight loss only. We do convey that it's not only the reduction of the body fat, but also the impact it makes in the brain level, the cardiopulmonary level, at the diabetic or the metabolic level, and the circulatory level throughout the body. This is what makes Ayurvedic therapies much more attractive than just losing weight or feeling tired. Now, this comes to also a very important point of how to come to a diagnosis. A proper diagnosis is very, very important. What I conveyed to you is the majority of the cases we find wherein food and lifestyle being faulty are implicated for the obesity. However, it is very noteworthy in our experience to realize that we do have situations of hormonal reasons for obesity, the genetic reasons of obesity, the metabolism being challenged, and also situations where somebody is on anti-diabetic medication, antipsychotic, antidepressive, those kind of inevitable reasons that a person is supposed to lead his life. And there are people who are using steroids, so they don't lose body weight easily, and the antidepressive, antipsychotic groups are not easily be able to be weaned off or to be taken out. And of course, there are people using beta blockers for their cardiopulmonary, rather for the antihypertensive reasons, which doesn't make it easy to lose weight. And similarly, we find that patients with PCOD, PCOS, polycystic ovarian disease, patients who are after delivery, after childbirth, and those with hypothyroidism, they don't always necessarily lose weight easily, and that can be very disgusting or rather disappointing if they embark into any panchakarma therapy and to find that the response is either denied or delayed, and the sluggishness doesn't help their mind or body anyway. But these are harsh realities that we definitely have to give importance and consider when we comment our cure prospects and the roadmap of recovery to any patient. It's very important to know the red flags of obesity. The fact of the matter is 20 to 40% of the population is either overweight or obese in whichever levels they get into. It's also a fact that it's something that can be reversed. We cannot forget that along with the anti-diabetic kind of medications, even anti-epileptic medications can cause obesity. We are aware of that fact. It's also very dangerous to realize that not only a person feels psychologically upset about his appearance, but also situations like foggy brain, reduced cardiac efficiency, breathlessness while climbing stairs, lack of stamina, lack of agility, lack of enthusiasm in life, sluggishness and procrastination in many works. All these very severely diminish the quality and the enthusiasm and joy of life. On top of that, things become complicated because the obesity is implicated to heart diseases, high cholesterol levels related to liver obesities, is related to the poor health of the lower limbs with lesser functioning of a lesser flow of blood to the lower limbs. It leads to gastrointestinal tract disorders. It has a big role towards obesity causing cancer, role towards cancer's development. The healing of many conditions are challenged by obesity. Diabetes doesn't get better if somebody is obese in an uncontrolled manner. So there's a huge list of cascade of diseases which succeed the entity of obesity. And that's something that is tragic, because in spite of the best medical care available in our society, somehow we are unable to find a lasting cure for obesity. So this is exactly where the role of Ayurveda comes in a very big manner. So let us come to some remedies that you can do at your home. Obviously, it is always sensible to have a proper diagnosis, a proper professional advice, and a long-term strategy than just losing a few kilograms for a few weeks and having a rebound weight gain, because a long battle is a silent assassin, long-term assassin. That's what I would call obesity as. What we generally recommend is a self-disciplinary approach, a moderate endeavor in a regular manner that can have a sustaining, deep, lasting effect. That brings us to the point that when we have a situation of restricting ourselves about 6,000 calories a week, it does plenty of good. Obviously, it will be frustrating. One single cheat day is okay to have indulgence to compensate for the mind crunch that happens in being in a hyper-disciplined regime. Typically, we advise our patients to watch and write down whatever they have been ingesting every day, including what they drink, which can be carbonated drinks, Pepsi, Cola, whatever kind of things, or whichever is sugar related. That brings us to the point that start a diary where you start writing how much you exercise, how much you eat, what you eat, how much you drink, and how much you relax. Because having just low glycemic index food material is not enough. Having low starch vegetables is not enough. Having pulses is not enough. We need to make sure that the body sweats out enough. One of the best practices people find is having at least 45 minutes of exercise every day, barring a Sunday or a week off, which is fine. It's also fine to have 2 weekly offs also. But this consistency is what would matter the most. The simplest exercise is the sun salutation. That is the best. You hardly have to spend much time elsewhere traveling. You can have at least 25 minutes to make 25 sun salutations, and that's a very good calorie burner. It gives very good stretching to different parts of the body, and most importantly, you are very much assured that instead of running on a treadmill or a long running in the road, you're not damaging your knee, because invariably most of those who are overweight or obese have a weak knee joint, and that can always be getting hurt. And any injury to the knee joint will further jeopardize your plans for further action. This brings us to the fact that it's very rampant in our society to use Triphala, which is good. But Triphala has the best impact as a rasayana only when you use unequal quantity of honey and ghee to it in a small dosage. This information may or may not be explicitly available in the websites, but it's very important for you to realize that low doses of iron, safely used, and elements of calcium, magnesium, til as you would call it in North India, or erla we call in South Indian Kerala, or sesame seed, they all have a role in the management of overweight or obesity. And that all is judicially advised by a proper professional, be it an Ayurvedic or any other system of medicine doctor. And the last thing we would always recommend anyone with body weight loss plans is to have proper relaxation, a thorough relaxation of the mind, either by breathing exercises or meditation or yoga nidra, is very essential to avoid getting into the habit of binge eating and what we call as emotional eating, which is very, very common in people who are obese and overweight. So this way, a comprehensive approach of food, of lifestyle, medication, exercise, patterns of relaxation make a wholesome strategy to ensure that not only you're losing weight, but also you're not losing your enthusiasm to sustain the body weight loss that you have attained. That makes a long-term fruitful innings for your health.